Hi, everyone, and welcome to the special simulcast of the Neil Haley Show and the Cutting Edge Benefits Podcast with our host, Tom Quigley from ClaimLinx. And Tom, today's topic, I'm going to take over for a second, read an article for people. And this is why I tell people, especially Neil the Media Giant Haley says, if you're an employer and you have a business and you don't use ClaimLinx, you are missing out tremendously. And you're going to have a lot of pain to tell your employees next year unless you contact ClaimLinx today. Why your 2027 paycheck could take another hit and what employers can do about it. So, this is a really big thing because the pain is going on another tax increase. And let me read this article to you. The squeeze on American workers' healthcare is about to get tighter. According to a new survey data, 2/3 of large companies expect to raise monthly premiums for employee health coverage through paycheck deductions in 2027. That's not a one-off correction. It's the continuation of a multi-year climb that has already pushed costs to levels not seen in over a decade. The backup tells the story. Mercer's national survey of employer-sponsored health plans found that the average cost of an employer-sponsored health insurance reached $17,496 per employee in 2025, a 6% increase, well above the rates of inflation and wage growth. And the relief of employers hope for hasn't come. An even higher total health benefit cost increase of 6.7 is expected in 2026, which will push the average cost above $18,500 per employee per Mercer study. Two forces are the driving spike. The first is drug spend. Prescription drug spending rose 9.4% on average among large employers, and more large employers choose to cover costly GLP-1 weight loss medications in 2025 at 49%, up from 44% in 2024. The second is the quiet strategic shift back toward putting the bill on workers. Mercer polled 711 employers and found that 51% said they are likely, either likely or very likely, to shift cost to employees to their 2026 plans. For employers, the math is brutal. Paycheck deductions for healthcare coverage are expected to rise up to 6 to 7% on average, as employee contributions generally increase proportionally with overall plan costs, and the affordability cliff is real. A Mercer survey of 2,000 U.S. workers reported that 28% of those household incomes at or below the median are not confident they can afford necessary healthcare benefits. This is exactly the pressure point ClaimLinx was built to solve. While most of the industries treat rising costs as a choice between two bad options, eat the increase or pass it to the employees. And we're the MERP and all that. So our guest today against Tom Quigley, it's his podcast. And here's my first question. The headline number is striking. 2/3 of large companies plan to raise employee premiums through paycheck deductions in 2027. When you saw it, was it a surprise or is it exactly what you've been seeing on the ground with employers?
Exactly what I've been saying is they think they can continue doing it the same way, and they're reluctant to change because they have their HR departments running it instead of the CFOs and owners.
No doubt. And you know the reasons why. But cost hit 17,496 per employee in 2025 and are projected at 18,500 in 2026. For a business owner watching those numbers, what actually is driving the increase and how much of it is within their control?
Well, the corporate greed. They're all stock companies. The Aetnas, the United Healthcares, the Anthems, all of them. They're all stock companies. So they're trying to drive profits. I mean, it's that simple.
About half of employers now say they're likely to shift cost onto employees. Walk us through what cost shifting really means for a typical worker, and why would you argue it's a short-term fix that creates a bigger problems?
They haven't solved anything. All they're doing is they're stripping benefits by increasing deductibles and copays and increasing costs for the health insurance. But until they change, they can't control anything. They're at the mercy of the insurance carriers. The ones who are self-funding are taking on too much risk, and people are hitting more and more because of the drugs you alluded to, the way they're doing it, and it makes no sense.
It makes
Makes
no sense.
zero sense. I mean, it's like you're sitting there going, trying to argue that 2 plus 2 equals 4, and people are telling you it doesn't. And it's
And
like, okay, great. You know what? You guys go live in your crazy world. I'm going to live in reality. The reality is reality. Same with health insurance. The reality is your system that you're trying to keep makes no sense, and it hasn't since the HIPAA or the Affordable Care Act. Now it's just hit a critical stage because a 5% renewal of 2000 a month premiums is significant where it used to be nothing.
right. And so what's interesting when you're talking about Tom is that uh, really what you're seeing is you can even decrease their healthcare expense by even more percentage each more time because you're seeing that really there shouldn't be these cost increase and you're able to see mathematically how to make it work for both the employer and the employee.
All the time. The employees get better benefits, the employer pays less. It's that simple, which increases their values. And if they don't realize that it's a direct hit on their balance sheet, both on theirs and the employees, uh, I mean, I can't help you.
Right. There's a real affordability cliff here. Nearly a third of median and below households aren't confident they can afford what they care they the care they need. What does that do to workforce terms in morale, retention, even productivity?
People are gonna have people, it's gonna, you're asking people to pay 1,000 a month out of their paycheck. It's 12,000 a year. No, that's a car payment, groceries, a mortgage, a rent. Uh, I don't get it.
And also forget vacations, right? When you're ending up having to pay out that kind of money. That
Yeah, I mean,
that
these are people that are making you money as an owner. The least you can do is show a little respect and change so that they can get better benefits and pay less.
because you're going to see less productivity out of them. They're going
Hey,
to
my
leave.
employees have 100%. They don't pay anything for their health insurance. They have a zero deductible.
Uh-huh. See, that's a great boss.
No, it's just common sense because I understand the laws. Um, but the trouble is why you're letting Susie or Jimmy, the HR director, make decisions for your company is on health insurance. I don't get it.
Yeah.
Don't get it. And why are you listening to commissions sales reps who get it? This is all great news for all of them. They get increases.
Let's get into ClaimLinx. For listeners who have never heard of the Medical Expense Reimbursement Plan, the MERP, is and how is it different from what companies are doing right now?
Some of them are actually using the same tax law, the self-funded ones or the HRA companies, but they're buying the catastrophic coverage or financing they're financing the benefits wrong, the smaller companies, and the larger companies are financing the catastrophic wrong.
Conventional wisdom says, Tom, you either eat the cost increase or pass it on to the employees. You say there's a third option. How does ClaimLinx model lower an employer's total spend without gutting the coverage employees rely on?
Implementing a tax law that's been around since 1954 and designing a benefit that's better for the employees and saves money. And I work on what I save, 20% of what I save you. So I put my money where my mouth is.
So prescription drug costs
Hmm.
jumped over 9%, and GLP-1 weight loss drugs
Yeah.
are a big part of it. How does that trend factor in the plans you build, and how can employers offer those benefits without blowing up the budget?
Well, if they understand drugs, most of the high ticket drug items, if you buy the insurance right, you're financing the manufacturer's rebate pays for your whole deductible, so they're not a risk for the employees, but you're not buying it right. The GLPs and other things, you can go to Trump RX and other there's other sites that allow you to buy them for, instead of 1,000 a month, 199 a month. The
So,
company can gladly reimburse the 199 tax free versus getting hit for 1,000. That's 10,800 savings a year per person on one.
so looking ahead, costs have climbed 5+% for years now with no relief in sight. Where do you see employer sponsored healthcare heading over the next 3 to 5 years? And what should business owners be doing today to get ahead of it?
Well, they're gonna have to. I mean, they have to change. The question is how much pain? When's the pain threshold enough that they just throw up their hands and say we have to do something different?
Exactly. So the best place to go, Tom, is so simple. Go to claimlinx.com. You can schedule a call with Tom or the team. And really, you'll just break down and say, this is what I can save you. And this is what kind of benefits I can provide for you. And it's a no brainer, right? Because then they're saving, they can put their money into other things, and their employees are going to be happy.
Exactly.
All right. So go to claimlinx.com, schedule a call with Tom today. Appreciate it, Tom.
Thank you.
That was a special simulcast of the Neil Haley Show and the Cutting Edge Benefits Podcast, guys. Take care.